Hey, just to let everybody out there in WebEx land know how we came to this point, we're about to have a presentation by the good folks out in Pittsburgh about their efforts with their Community Veterans Engagement Board. A while back, the Veterans Experience Office undertook a discovery sprint where we went all over the country learning about best practices, gathering lessons learned from folks to take the CVEBs to the next level, what we're calling next generation CVEBs. And everybody that was there was really struck with the great work that your next speakers, presenters are going to talk about how they got to where they are with their CVEBs. So with that, I want to turn it over to Pittsburgh, to Megan and Stephanie, and the floor is yours.
All right, I'll just kick it off here and say thanks for listening to us. When we were putting this together, wanted this to be helpful to those of you out there designing your own CVEBs, and so we'll go through some really the process that we've gone through over the last, I think it's been 14, 15 months, and show you a little bit about what we've discovered and the way we've done it. Stop us at any point if you have questions. We're hoping that little bits and pieces can be taken from our presentation, or this presentation, and kind of the work that we've done, and be helpful to others.
Just going to introduce who you are.
So yeah, I'll just kick. I'm Megan Andros. I'm a program officer behind Endowment. Just really quickly, it's a private foundation in Pittsburgh, Pennsylvania, and we do a lot of things. But in the last 4 years, have had a strategic focus on our military veteran and family member population. And we, in short, believe veterans are assets to Pittsburgh, and we're trying to figure out how to better connect them to resources to the community as they get out. I am, you can kind of see, I'm a Iraq vet, spent 5 years in active duty in the Army, and then my husband is also a veteran of the Iraq War, so I bring those kind of two lenses to my work, both on this and in kind of what I do on a daily basis.
Josh. And I'm Stephanie Grimes. I am a spouse of a veteran. I run the program for The Mission Continues here in Pittsburgh, which is a national nonprofit. Seen it a couple times in other people's presentations today. We help veterans re-identify their sense of purpose through community impact and service. So we provide different avenues for volunteerism to help veterans reintegrate back into the community and feel like they're serving and in fact give them pathways to serve back at home. So Megan and I took this on a couple years ago, and we're just going to dig in. We want to say that we have an hour scheduled for this, and this presentation should certainly not last a full hour of us just speaking. So if anybody has questions, comments, feel free to just chime in as we go here. 5 minutes. It will.
Okay. All right, really quickly before we dive in, I just wanted to give you a sense for what Pittsburgh looks like, what we kind of, where we sit, what we're dealing with, and what we knew kind of going in. Pennsylvania has the 4th highest veteran population of any state in the country, and Allegheny County, which is Pittsburgh state, ranks roughly 17th in population. About 1% of the country's veteran population lives in the Pittsburgh region, which is really weird but true. I gotta go back.
I did. It's just on the
okay. We also know that we have about 28,000 reservist guardsmen and we have an active duty Coast Guard unit here who patrols the 3 rivers around Pittsburgh. We went into this knowing that we had 180 nonprofits that were located, that lived, I guess I should say, in Allegheny County that exclusively serve veterans. So that does not count those whose primary focus is not the veteran community, or we didn't really count universities or kind of government agencies and entities in that number, so we knew it was complex. We also know that there are about 45,000 post 9/11 veterans that have returned to the Pittsburgh region, and we have the number 5,200 is what we think that we're seeing every year returning. And we know specifically those two last data points from a Center for a New American Security Study funded by the Heinz Endowment that was published in November 2015. Do you want to do the next?
I was just going to say, so this is the information that we had prior to taking on anything with the community engagement board, this was kind of the basis based on the needs assessment and just local research. This is what we had going into it. And so knowing this information led us into identifying who our board members are going to be, and we intentionally and strategically, it took us probably longer than it should have, to try to determine not only what agency needed to be represented, but almost more important to the agency was the individual. I mean, both of them were weighed, but we wanted to make sure that we had people that were going to a community. We knew we were going to be taking an approach that wasn't done before, and so we wanted folks that we knew would bring something to the table that would align with the innovation and that could have different lenses that they bring to the strategy once we got there. So what you're looking at here are those initial the board members that we brought in. As you can see, the VA, all of the leaders within healthcare, sanitary benefits. We also have some local nonprofits. Ben Stahl with DLP is a localized Pittsburgh nonprofit. We have some corporate folks. We have and government. So we were really thoughtful about who was coming on. Anything you have to add to that?
I would just say, I think we believe that a lot of times in that space, we think only veteran or veteran organizations can solve the problems of veterans, and we wanted to think beyond that and see what innovation we could and what we could learn from organizations outside of that space that we could pull into the work.
Yeah, so there are many veterans on here, and then there are folks that are not veterans, and that was intentional. So our first step that we knew we needed to do before we dove into any kind of action of problem solving, when we talked a little bit, we just said that we were going to be a bit innovative and do things a little bit differently. What we meant by that is something that doesn't really sound all that innovative, but it is different, and it was taking a step back and really understanding from a human-centered standpoint, using human-centered design, who are we looking to serve, and how, before we could figure out how are we going to better serve them. So we took that needs assessment. What you see there up on the left is just the actual assessment that was funded and came out right around the same time this was launching. So we had a really good landscape with those bullet points from before. And then we went and did, we call them forums, the military and veteran forums. And we did 3 of them. We did 4 total. 3 of them started with the veteran, the service member and veteran. And we, in different locations, geographically spread out throughout the Pittsburgh region, because people don't like to cross bridges or go through tunnels here, so we needed to make sure we were getting a good representation, cross-generational representation of veterans. So we had 3 different forums back in February of 2016, where we worked with an agency called the Art of Democracy to help us formulate these forums and to ensure that they truly were human-centered. So we pulled, it was about 50 people at each one, 50 veterans. It was a pretty good mix generationally and just in diversity in general. It was pretty representative of the veteran community here in Pittsburgh. So we had those, and we brought them together, and we had facilitated conversations, table conversations that brought out discussion points and areas that we can then pull as a board and start to identify trends. We'll get into how we did that in a little bit. I don't want to dive too deep. But we allowed them to facilitate, with a facilitated table, to dive into certain questions, to ask our board questions. We had leadership from the VA as well as other organizations there to answer questions. And at the end of it, we were able to get feedback from them, both in the questions that they asked, in the conversations that they had amongst each other, and then at the end of it, we asked them to complete a pretty comprehensive survey that we were able to pull information out of.
Let me jump in real quick and say, just tactically, for those of you who are listening that are running CVEBs in your communities, you can see this, the needs assessment on the far left of your screen, and then a call to action, community forums for military veterans, is actually the document that we created, that we circulated widely on a lot of social media. And at the bottom, you can see we partnered with the Allegheny County, we partnered with the city, we partnered with our local community college, the Mission Communities and the Heinz Towns obviously needed to have buy-in for us to do this. And so to get all of those agencies on board and moving in the same direction took a lot of work, but we thought it was worth it. You can see just to the right of that, we used Eventbrite as the way for us to find out who's going to come, and again, just distribute information, give people directions. And then the documents on the far right are our agenda for each of the 3 forums, which we had nailed down, as well as the questions that each table monitor took that through. And as Stephanie said, we as a board were able to see what rose to the top. It was the questions they asked the panel at the end of each session was things they couldn't resolve as a table, and then we were able to see what those trends were, both in the individual forums and then across the 3 forums. Probably.
And there were trends. This is, I said that we had a pretty comprehensive survey. This is an example of the survey that I think we had a 98% completion rate from veterans on this survey. And very many of them looked like this. People took it seriously. They were given it at the end of their facilitated sessions, so they had the buy-in, and they knew we were going to be doing something with them. There was a level of trust that they had to trust that, Megan and I and the rest of the board were going to actually do something with. But it's something that you'll see as we go through, that this is an essential piece, both for the data that we were able to analyze and to start to identify the needs trends, but it's also an essential piece for us to ensure that we are re-engaging those veterans who said that they wanted to be re-engaged through this survey. So you'll see this come up again later in the presentation of why this is, aside from the pure information that this gives us, it also allowed us to have a contact point and a way to make sure that they continue to be part of our design and that it truly is holistically human-centered.
I want to point out, too, really quickly that from these surveys, we're mindful of getting qualitative and quantitative data, and you can see there's a lot of open-ended questions, and we thought that was really important. So everybody filled this out at the end of the forums, and it allowed them to kind of maybe share more personal stories or anecdotes or thoughts about some of the things they encountered during the transition, or maybe potentially some that there were some things they were still dealing with.
I don't know if you might not be able to see in depth like what these things were assessing, but we've asked them to put on a scale of all the different kinds of issues on the check box section. There's lists of different types of issues, and then they were kind of rating them of whether they were a challenge or not, and if so, to what degree are those things challenging. And so this is both the quantitative, qualitative. This is stuff that we were able to then take. And then, with so much fun, we were able to then transfer it into a document that should be coming up. There it goes. Being funky.
It hits the WebEx much faster.
Okay, so they're seeing it quicker than I can. Okay, good. So this is just the example of how we transcribed this data. And Megan and I, as the board chairs, we did take this on, just the two of us. We thought long and hard about what our roles as the chairs were, and when we decided to ask the folks that were on that roster to be a part of it, we knew that these were senior level, for the most part, very busy people. And so, we bit the bullet and said, we'll take at the front end, because this front end is so essential for us to be able to do effective things later on, and knowing that we're really addressing the right issue, that we would take the brunt of it. And so we did transcribe all of this, and we organized, essentially, we organized all the data so that we can then present it in a less tedious and overwhelming way than this Excel file to the rest of the board, so that we can then do some work with the board with all the data. Do anything?
Just really quickly, I think we probably should have said it more clearly at the beginning, but we have a lot of talent on our board, and we could have sat around a table and identified things to work on and gotten started the same meeting a month after. But we made a decision not to, and potentially one of the reasons we are able to do that is there's a lot of stuff already happening in the Pittsburgh region. So it's not as if needs are not being met already. There are definitely some gaps. And I think we also wanted to spend some time thinking through what was within the capabilities of the CEB and what wasn't. So we all have our individual interests, and we wanted to make sure that the CEB didn't become that, and that instead it really represented the community's desire, and that we got a good sense for where those gaps were before we dug in. Just wanted to say that real quick.
So this is basically what we took to our board. So we took a much more organized version of data that we pulled out, making sure it was holistic and showed every piece of information that we pulled from those surveys, along with the needs assessment. So these two things together is what we then brought to a full day of data analysis and workshop with our full community engagement board. And we, I don't know how many of you guys are familiar with human-centered design, but we were able to work with one of, in our humble opinion, one of the world's best design firms, Luma Institute, which is headquartered here in Pittsburgh, where the entire board spent a day digging into this and really trying to, like talking to the veterans that came to these surveys. They weren't physically there, but all of their comments and their input were. So it was a time where we were able to really dig in, and as a group, with different opinions, with different biases, with different avenues that we all work in, really pretty amazingly came to a very obvious consensus, because there was no way to ignore the 4 trends that came out of it. Like it was just evident. And this process, it was a full day, and this process allowed us to get there, and it was well worth it. It was well worth the time and resources that were spent on that back end, on that front end, in order to get that consensus and really have everybody feeling like, wow, now we know where to focus. So this is an example of one of the exercises that we did based on a video. We did have, we play it today, but we had a video of one of the forums, and it shows the interactions, and you could hear the conversations that were happening. And so after that video, we did this exercise that really got into finding the roses, the thorns, and buds, so the positives, the opportunities, and the negative things that came out of that. And the little red dots that you see were at the end of the day when we started to vote on where we think as individuals that our focus needs to be, and where you see all those red dots, all those red votes, are the areas that were trending amongst this activity, as well as ones that you'll see here in a minute. Do you have anything, Mike?
No, we'll go to a couple of other examples of the human-centered design work we did. So this is actually, so we talked about the questions that each forum asked the community engagement board at the end of the forum. So the things that rose to the top of the discussions that weren't answered by anybody at the table, and this is across the 3 forums, and as you'll see, there are some questions that came up more than once. And so those are representative of, again, the things the community wants to know, feels like it's missing, and wants kind of answers too, that we didn't have at that point. So that's just how this is organized right now.
These were literally clippings of that survey that we showed you, everybody's survey, and then I clipped out all the answers to all of them. And so it's like we were like briefly speaking to people that weren't there. This is an example of that. So we were able to read each individual's response and then cluster them along with similar type questions or answers that allowed us to see trends. This is another example. These were actually taken straight from the needs assessment, not from the survey. So these were issues or things, I guess that's how to explain it, in the middle of that tree that were stated in that needs assessment. And then in teams, we had, I think, 5, 6 teams of this through the board. We came up, the teams developed what the causes for that issue are and what the effects of that issue what's causing it and what are the results of that being a thing, if that makes sense. And so we had about 5 of these across the room that also allowed us to again identify those trends that we were seeing in each one of these human-centered design activities that we would do.
Okay, so this is the quantitative side of the data. That Excel spreadsheet you saw, we literally broke down every person's responses into were they a combat veteran? Did they not deploy to a combat zone? What era of service? Were they a guardsman, reservist, active duty? And we just broke it down by age, by gender, grade. I mean, we really kind of dug deep. And but we wanted to know how each of those categories of folks that attended the forums felt in the areas of, as you can kind of make out, maybe underemployment, how much of an issue they thought each of these things were. We looked at underemployment, disability, military gap, legal needs, unemployment, homelessness, physical health, access to military benefits, housing, and mental health. And so, as you guys can probably tell, underemployment became very, very quickly the biggest and greatest issue. We were also able to identify, you're not going to have the time to stare at this for long enough, but that our guardsmen and reservists here in Pittsburgh are faring way worse and are feeling worse about their current situation or kind of what they've had to go through in their life than our formerly active duty soldiers. And so that became really, really clear to us through this exercise.
Yeah, and that's something that comes up all the time here in Pittsburgh, but we never really had any concrete evidence behind it. So this allowed us to really to dig in. So we know we have a large reservist National Guard population. We know that there's struggles there, but to see that 100, that's that 100 that you see right there on the underemployment, that's National Guard Reserve. So 100% of the people noted that underemployment was an issue for them. And then if you see some of the other ones, they're all very high as well. So that was an area where we're like, well darn, if we start to explore underemployment, we're tackling everybody's needs if we go there. So
one other thing I'll say is something we were surprised by is actually the number of people who put legal needs down as a really important thing to tackle. That was something I wasn't expecting. So again, had we sat around a table and started to make decisions, that might not have been something that we identified.
Yeah, and you'll see later about legal. We dug in a little bit farther into just it's a legal need that we believe based on this data that it was lumped in with another issue and just the lack of the resource. But we'll get into that here. Again, this is just another one of the things we did in teams, taking questions or answers to some of the long-handed questions and grouping them. Each team had different responses. So each team was responsible. For instance, this team might have had to see it question 7 and question 11. And as a small team, they would cluster them and start to find those trends. And then another team would have question 5 and 6. For instance. So at the end of the day, we had all of the questions accounted for in this clustered way. And I want to just remind everybody that the people that were doing this work were actually those people within the board themselves. And so this was a great way for us to dig into this together.
don't go. Yep. So quickly, just to give some more context to this one question and how this was informative to us. So the question was, we asked the forum participants, can you please identify or tell us about barriers that you're seeing to thriving in our region as current servicemen, veterans, family members? And you'll see kind of in the middle on the left, fractured services, and it's probably hard to tell, but there were so many people who made a comment about how navigation of services was an issue, and for us it rose to the top as well as eventually. But it was really to take those qualitative answers and start to gather data on how many people of the 120 we touched were struggling in this area, and you can see by the picture it was a lot.
Yeah, this one also has the military civilian divide, which is one that this is where we ended. So after, if you can imagine, we were literally in a round room. Is there in the next one? So, okay, so it's a round room, all whiteboard, and every one of these activities were just plastered around the room as we went along. And at the very end of it, we inspected all of them. We went around individually, we read everything, we made sure that we had understanding, we did that voting that I talked about. And then at the end of it, there were 4 major trends, and these are them. So this we literally took this underemployment, military civilian divide, the navigation of services or offerings, and then the services matching the needs, which is what we talked about. We talked about that as it relates to legal. We made some adjustments from this when we actually went in and did the charter, because as we dug in, the services matching the needs was really more allocated to the navigation of services. They were an issue that needed to be tackled. They were kind of one and the same. And so looking at this stuff and then back into that needs assessment, one of the other trends that we decided on is underemployment, military civilian divide, navigation services. And it was something that really stuck out that none of us really thought was going to be there, and it just sat wrong with everybody in the room.
More of an opportunity.
Yeah, an opportunity. And it was that here in Pittsburgh, we had significantly less people successfully utilizing their GI Bill than the numbers nationally, which was really, because we have a lot of universities, and I know we're biased, but we think they're good universities. And so a lot of the veterans that we've interacted with on a that I've interacted with on a day-to-day basis came to Pittsburgh because of their university. So it was very shocking to me, and not just me, to the entire team, that was something that we were seeing in our region. So it was an opportunity that we decided needed to make its way to the charter. So we identified the issues, and so then we went ahead and did these how might we statements. And this really just allowed us to start to think about not getting into solutions, but getting into, again, the needs piece, digging into it a little bit farther, of in an ideal world, how might things look if these things were not an issue. So what this allowed for Megan and I, so they were saying, we want a charter, we need a charter, and we don't know our needs yet, right? We gotta get our needs out first. And so between that last slide and this wrote our charter. Yeah, it was a plug and play from this point forward.
You'll see in a minute that we actually went back to the veteran community. We called some of the folks that were at the forums, and then kind of additional people, and those how might we statements that we created from the 4 focus areas, we actually basically posed those questions for the community to help us create solutions. So you can see here in this slide, these are pictures. These are our community engagement board members, and pictures of the day we spent kind of digging through, walking through the data at the Lumen Institute. So as Stephanie was talking about the round room, you kind of get to sit in that data. Overall, it was a good experience. Yeah.
Do you have any questions so far? Timer.
Go for it. Hey, this is Chris Lucci, Herndon Veterans Experience Office. 2 questions for you, if you don't mind.
Sure.
How do you compare these results to the data, the quant data that PA Serve provides you?
Great question. I think there's been a bit, how do we, I don't know that we've ever actually, to be honest, I think PA Serve, I'm going to be honest, PA Serve has been in operation for a year and a half, and I think we feel really good about the impact it's had on the community, but I don't know that we have enough data at this point. We're learning a lot from it, but to really be able to compare and contrast these two initiatives. I think that they both are telling us important things, but how much of the same people or different audiences are they each collecting? It's just more data. Does that make sense? I don't know if that's
Yeah, I think it's a piece of the puzzle. I don't think they're contradictory to one another. I think it is definitely something we're keeping an eye on as the board. In fact, we have an individual on the board that represents the organization that currently houses PA Serve. Does that make sense? So Mercy Community Health is the one that has the contract. I don't use the
coordination center.
The coordination center in Palisade Mercy. So one of the women there that you see in these photos is from Mercy. We also have the person that covers PA Serve from IVMF also sitting on the board. So we think that it's important for PA Serve to also know this data, and then as well as for us as a board to be reviewing that, not just from PA Serve, but from all of our organizations here, and starting to collect data as it relates to these issues. Does that make sense?
Earlier we talked about Unite Us and USO, and everyone has this data, but commend you all for using human-centered design to get the qualitative. But when you get both, it's like when the results aren't necessarily the same. How do you go about it? What do you decide to focus on next?
Yeah, I think it's a good question. I don't know anybody has a great a perfect answer for that. I think it's just data sources that we can walk through and use. I'll tell you too, in case it's helpful. So PA Serve launched in October 2015. The study came out in November 2015. The forums happened in January 2016, and the Community Engagement Board met in March 2016. So that's kind of like the timeline. So you saw that one question about how everybody cited navigation of services as being a really big issue. Well, that was 4 months into PA Serve being in operation. It would be interesting now for us to go back and ask how many people now know about that as a resource, and whether the answer, maybe we don't see that quite as much. But there's also this opportunity for that goes to the top of the list of things we needed to work on. Maybe the CEB becomes kind of the folks who help get the word out into the community about the fact that PA Serve exists. And again, I kind of mentioned earlier, there's a lot of stuff happening in the vet space in Pittsburgh, which is really great. But it's almost like we've walked through the process pretty slowly, but thoughtfully of gathering data, and it's not like the community stopped moving or working. So I don't know. I'll leave it there.
Yeah, and I think this is an ongoing process. It always will be. It's data, especially, and this is a funder's dream, right? Like to have this data to say like where can a funder plug in or and actually start to make a difference, and then having a thing like PA Serves where we have this ongoing collection of data that we're going to be able to analyze as the atmosphere in the veteran space here shifts, because it ultimately has. I mean, I've been here. We came here. My husband and I came here in 2011, and from 2011 to 2017, the veteran space is just absolutely different, and a lot of it has to do with philanthropy, taking a step up and saying we're going to look at things differently. And so this will constantly be transforming, and I think we're lucky to have PA Serve to have that constant ongoing data set, but we would be foolish to think that that is the only representation of our veteran space in Pittsburgh.
Yeah. Did you say you had another question?
Yeah, one more question. Sorry. Hopefully this is the softball. in terms of you guys doing all this work and then deciding what to focus on, how are you going about measuring it to determine its success and impact?
All right, so you're getting ahead of us, because, you know, what you'll see here is we actually haven't started implementing yet. We've been digging for like a year. We've been digging. All the while the community's been responding and working as it always has been. But so again, the community engagement board was not starting from scratch. It was more getting the right people in the room with the right information to kind of fill in and identify where the kind of current systems we're not meeting. I think your question's good, and I think every community engagement board, I think we're going to struggle with that.
Yeah, I think we're getting there. So the next step after this, I don't know what the next slide is, but, we'll get to this, but basically, so we were digging in, which is this really long process to get to the understanding of the need, right? The next step, and I don't know if you guys have ever done human-centered design before, but this can sometimes be the most challenging thing for people like myself and pretty much everybody in that room, because we all are just so ingrained to jump to solutions and outcomes and measurables that it's like, all right, well, okay, they said this, well, I know how to fix that. And that was part of the how might we thing. We had to really take a step back and say, let's not come up with solutions quite yet. We need to do this in a way that is structured to the human-centered element. We get to solutions, but it's got to be through this process. So we finish this process for now. There'll be a reevaluation phase at some point. We're going to get to the rest of it first. And then the next step, and we're going to get into it in a minute, so I don't want to the next step is that we've done is to start thinking about those solutions. So we have the needs, let's think about the solutions. Once we've started to identify potential solutions, then we can get into how do we measure them.
Well, and I'll say too, and a simple answer too is we're going to look at PA Serve. You know, I think PA Serve is going to be consistently gathering data regardless of what the community engagement board does. But hopefully we'll start to see decreased levels of people looking for trying to find legal services, or maybe they're measuring urgency of needs, and maybe it won't be quite as urgent. Well, you know, maybe we'll start to see a positive kind of relationship between what the CVEB is able to do and kind of the data outreach on that end.
Another piece to that, and this is something that is helpful here, and I don't know if this can be implemented. I mean, it could be, but one of the things that when I said this is a funder's dream, we're so lucky to have Megan as the co-chair on this, that is representative of a foundation, of the Heinz Endowment, because when not only just a foundation, but one that looks to innovation and looks to these kinds of models before making their funding decisions, because now we have a model of where the money, not just from the Heinz Endowment, but to foundations, to the government, anywhere that can bring in money, where they can be focused, that's really going to make a difference. And then as grant givers, they track outcomes, right? So she likely isn't going to go give a grant to someone that's not going to be addressing one of these issues in some kind of way. And she's certainly not going to be giving a grant that doesn't require outcomes and tracking. So if someone, for instance, the mission continues, is conquering something along the lines of military-civilian divide, there's going to be reportable measures of how are we going to measure that as an organization, because that's what's important in Pittsburgh. And so if there's, from that element, we can begin to track outcomes, but as we start to develop solutions that the board may or may not be working on, we're not quite at that outcome development stage.
Is it a question from Boxborough?
On the screen? Go ahead.
Hi, Megan and Stephanie, this is Mike Criscola from the Connecticut CVEB. And actually, when you mentioned the underusage of the GI Bill in Pittsburgh, my ears perked up because I am the director of the state approving agency, and I would recommend that you and other CVEB utilize the state approving agencies in your state. There's 52 of them. between the states and the territories. And the state approving agency actually approved all of the institutions and the programs offered within a state to use the GI Bill, whether it's a high school diploma, a technical school, degree, apprenticeship, OJT, even certificates and license per state. And I would say reach out to the Pennsylvania SAA. The director's name there is Chris Hawk, and they'll be able to track through the report control system, through the VA systems, how many VA beneficiaries use their benefits for the GI Bill, and also retention and a really good resource for programs.
Great, thank you.
Thank you.
All right, I guess we'll
Anyone else before we keep going? Good.
All right, so we'll jump in with the next thing we did in June of 2016 is Service Provider Forum. So as you'll kind of see the trend here is that we spend a ton of time getting ready for these forums, or kind of each activity we've done so far. We spend an entire day or so doing them, and then we take a 2-month break as we're getting ready for the next. So big events rather than lots of small ones has kind of been our pattern so far. So here in June 2016, we held a service provider forum very similar to what we did with the veteran community and military service members. We also had them fill out a survey. We had them around tables. Art of Democracy, the organization, helped us guide them through a series of conversations, and then ask the board questions. And really, we wanted to test the 4 priorities that we were seeing. We wanted to see if we were way off base and to see if we were missing anything. I don't know if you want to jump in.
Yeah, so this was something from the beginning. We knew, as quote unquote, I guess, service providers, like we knew that these are the folks that we often go to first for understanding the needs, and we wanted to make sure we went to them because their point of view is very important. They're in the trenches a lot of times doing work, case management and so forth. But we needed to make sure that we were truly hearing the veterans' voice first, and that's why we did this. So we did those veterans forums, we analyzed the data, and this is like a checks and balances system for us. To go back to the providers and say, hey, look, this is what we did, this is what we came up with. Because poke holes in it, and really there were no holes poked. They all were like, yep, that sounds all right, and it allowed us to make sure that their voice was part of it. It also allowed us as board chairs, to start thinking about, for the sustainability standpoint, are there other providers here that we would want to bring in the board and so forth. Oh, okay, but this we can go. Okay. All right, so the next step that we did after we gathered all that information is we brought the service members and veterans back together with these 4 areas of focus. I mentioned earlier that the surveys were really important for this. We were able to go through the surveys and actually, read what they wrote, and Megan and I were able to target. Like if someone spoke a lot about underemployment, I called them and I said, hey, we're reconvening people and we want your input. And this is where we started to develop solutions, again, using human-centered design. So we brought them back in groups of 15. So how many? 60 of veterans came back, and we did individual workshops in each of these 4 areas where they started to generate solutions, ideas around how to start to tackle some of the issues that we had, and then we laid them out on this important difficulty matrix that allows us to then, this is where we are now as a board. So the next step is to take this information. There's an axis in that center picture of like things that are really, really important but may need more resources or less resources. But we can look at that as a board and begin to start to make action steps and start delegating a lot of the action steps to the board and go from there. So that's where we're at with that. Maybe you got something.
Well, I guess I would just say, I think, Stephanie, I feel like our job, the first part of this 14, 15, 16 months or so has been to kind of dig in and organize these events and not ask our board, who's super busy, to take too much time away from their daily lives and kind of, but obviously they've been active and they've been with us for days at a time and through these forums, but now we're really at the point where we feel solid about what we have and the suggestions we've gotten to the community about what would be the most impactful ways to handle this. And so I think our next step is to kind of turn this over to the board and kind of figure out how we all tackle this together and ask them to think about the networks they have and the impact that they can make. So that's our next. So the next one step.
Summary, and it's not wanting to go.
Okay.
Now it's on and out for you on that one. But, so this is just a summary of everything. We probably talked you to death here.
Still have 2 minutes. Floor is all yours.
Oh. So we have the 4 focus areas. We have the charter has been created, and we have the 60 volunteer or veteran service members that reconvened for the solutions phase. Our next step is to bring the board back together and start to dig into those solutions and start to really develop an action plan. I know you're probably wondering yourself, many of you, about the cost of using not of using human-centered design, but using a human-centered design firm to assist us in this. We, as the board behind, about $80,000 has gone into this. Knowing that it is important for the board, but it's also an essential for the philanthropic community, knowing where the money is going to be best spent as an organization outside of the work of the board. So yes, there was money, and I know not every community has access to that, and but I would pressure you to think about, there's a lot of things that can be done and these models that can be used or pulled from that might work for your community that don't require money.
Just a lot of work.
Yeah. But that having chairs or people on the board that are see the importance of it and are willing. I mean, Megan and I both have full-time jobs that this is not a part of, and so. And there's been a lot of hours that have gone into it, but because we knew that this was important for our community, for our city, for our veterans, that we were going to do it. So that's.
We should stop and see if there are any additional questions now that we're pretty much through the bulk of it.
2 o'clock on the dot.
Yeah.
I mean, you couldn't do that any better. Questions? Mic is open.
Actually, not a question. I just want to thank Megan and Stephanie very much. Anybody that still has questions, I'm not cutting off conversation, but I want to thank you guys for being patient in all of my many emails that I sent asking for your help with this. Really appreciate it. One reason I reached out to Megan and Stephanie for this is that everybody on the Veterans Experience team has received training in human-centered design. 1, 2, or 3 classes, but we've rarely actually put it into practice. And to see you guys actually using it and coming up with a tangible results I was very impressed with it when I met you guys several months back. So really appreciate you sharing that with the whole group. So anybody else got any questions?
Boxborough has a question.
Yeah, okay, Boxborough, go for it.
Hi again. Stephanie and Megan, thanks so much for your presentation. We've probably been on board about the same amount of time. But I'm interested in your forum. You said you had about, your forums, you said you had about 50 folks at each group, at each presentation. I thought that was great. But I'm wondering, did you get those kind of numbers because of the fact that many of your service members or their families are unemployed or underemployed? I say that because we put a lot of effort into one of our forums, and we didn't get the greatest turnout that we would have liked. We had all the providers there, but we just didn't get, what we were hoping for.
No, we were really thoughtful. So we were really careful, and this is hard. So we feel your pain there. we thought about non-traditional networks. We thought about strategic partnerships, the library system, obviously the mayor's office, sending it out on social media, maybe like who are we not already reaching? And we went to places and people were already in the circle that we knew of. We kind of tried to go somewhere else. We obviously let them know and wanted them to bring their folks, but universities, for example, was another place. And we ended up getting, when we broke down combat, not combat, male, female, reserve, guard, active,
Vietnam,
in different eras, we actually had a pretty even representation from all of that somehow.
But we also were really thoughtful about the time of the event because we wanted to make sure that we had it on a time that it's never going to be convenient for everybody. But we did them in the evening, like I think 6:30 we started them on weekdays, so people could leave work and go straight there, so that we weren't only getting the folks that maybe were struggling with employment, or a lot of times here in Pittsburgh, I was saying in other cities, if you do it on a certain time, you'll get all the retired folks can come, but nobody else can show up. We did not want that. We wanted the retired folks to come, but we also wanted other folks to be able to come in. So the timing, we made sure we did it on a weekday, on an evening. And I think that piece of it, along with the outreach, I mean, I literally walked into gyms and I was the creepy lady, like, hey, were you in the military? And I fired. I did that. Not my finest moment, but it happened.
Getting ready for that first forum was a lot of work. And we were really careful about our language and
We have a few creepy people here in Massachusetts. We did a lot of creeping.
Hey, I grew up in Connecticut
You make a good point because we struggled with when to do it, what time of day, what day. We went with a Saturday, which early Saturday, and turned out to be not the best weather day, but we still didn't get what we were hoping for. And so now we're at the point where do our next forums with the same topic as we did ours on sustainable housing. Anyway, we're ready for our next step. So this kind of helped, gave us some ideas. We were fortunate a lot of the hand stubby pencil stuff that you guys went through. We used some information that we got from our board members who have been out there doing this kind of thing all along, like we said. We also were relying on the results of a Band Corporation did a study for our state assessment. But they did this only on veterans. So we're going to be following up primarily through our National Guide and our ISPAC that is going to be doing the study on the families. And then we're going to do another needs assessment with our families of the fallen. So we get everybody doing the veterans. It's not going to be enough, and they don't participate as much as we need them to.
Yes, I have read that Massachusetts RAND report recently. I read that, and if you ever, I cover Boston for the Mission Continues too. So if I can ever help in assisting with getting word out for things, please let me know.
That would be great. We appreciate it. Thank you so much.
I'll be there tomorrow.
Oh, yeah, I would say don't discount those organizations. We rely heavily on the Mission Continues, Team Red, White, and Blue. And it's our community colleges, our universities, like, we want to reach out and touch veterans. That's the staff.
The post 9/11,
Post 9/11, especially. Yeah. It's hardest to get them, we think.
Yes, that's true. Great, thank you.
Thanks.
I've got a question. When you mentioned, ladies, when you mentioned the what you thought to be an underutilization of the GI Bill in your area, did you drill down into that and seek any correlation between your homelessness numbers, your employment numbers, and your GI Bill enrollment?
So our homelessness numbers are very, very minimal. It's actually one of the things that it's a bit of a misconception, we believe, here in Pittsburgh about homelessness. So there wouldn't be, I don't believe, a strong correlation there just because the numbers are so small. What was the other? What else?
Homeless, unemployment. So just to give you some context, so in Allegheny County, I think we have 3 unhoused veterans at the point in time survey. We know where they are, who they are, and that they don't want to move into housing. So homelessness is not something that we're really struggling with. Our cost of living is not Boston or San Francisco or New York City, right? So that's one thing we have going for us. Unemployment is not our issue, it's underemployment. We know that. The veteran unemployment rate is very low, lower than the civilian average here in Pittsburgh. But the underemployment rate is a really big issue that I don't think nationally we figured out how to measure, or we're not really talking a whole lot about it. We on the board asked the veteran population specifically about unemployment and underemployment and how they felt, which one was more important. And it was very clear that underemployment was what they felt was the issue, and the data shows that as well.
I think, though, to your point, it will be interesting when we go into the next phase, when we were looking at the solutions, because we broke up the groups into solutions, like, into groups based on the 4 areas. So it's possible, and we haven't dug into it yet, it's very possible there may be a solution for the education stuff that may look very much like a solution for the underemployment, and at that point, we can then merge that and figure out, is there some camaraderie there, is there something, comorbidity there? But we don't know that, but you bring a good point up to make sure that there could be some correlation, in the solution phase to that.
Well, the reason I ask is in our area out on Long Island, we have noticed that, these are one-on-one interviews, face-to-face interviews, where we've had a lot of veterans who are enrolled in school, and they're very open about the fact that being back at school is not necessarily their first choice, but they chose to enroll in school because of the housing allowance. And, so I guess my concern is, are other areas, and I'm sure that there are, but I'm just, I guess, trying to take the temperature in your community, if that is as prevalent in other communities as we're seeing where we are.
I think for sure. I actually think that would be a good topic of discussion at some point. I mean, we know from the study that the university getting, or the college getting, the bulk of the GI Bill funds, or I guess having the largest percentage, is our Art Institute online of Pittsburgh, and the graduation rate is like 8%. So our thinking is that it's a way to get housing and not necessarily actually go to school. I don't know what we do about that at a community level, other than make sure there are other options.
Well, I would encourage you that if it does become something that, you're talking about a low graduation rate in that one instance. One of the reasons that this came to light for us, it came to our awareness, was when veterans do not complete their studies, they very often, there are exceptions, and they do have an opportunity to go back and make up their credits. But generally, if the veterans do not complete their courses, they will result in an overpayment, and then they will be responsible to reimburse VA for all of the money paid under GI Bill, which really sets them up for not good things going forward.
Yeah, I mean, the study very blatantly said those who are graduating, successfully using their GI Bill and graduating have much higher quality of life in the long term, and higher rates of being satisfied, self-reporting, than those who aren't, and those are all potentially reasons around it. So it's something we're going to dig around in for sure. And if you find something that's super compelling in Long Island that might be going on that we should be putting under a microscope here, please feel free to share.
But while we have the audience, though, we should say this should, if at the community level, the colleges that are taking students kind of
So are they like a
thing on them? That we at the systems level, I don't know what role could the VA play in starting to think through these colleges that have low graduation rates. Like, let's figure out how we're doing, because I think I would put money on it. Everybody's dealing with that same thing.
Yeah. Thank you.
Hey, so this is Moses here, Raleigh, North Carolina. Just wanted to mention, with us here in the state of North Carolina, like our university school system, our 4-year, 2-year school, they're doing these annual conferences and regional conferences of best practices within the state with the private-public school system, as far as 2-year, 4-year, and then the pay-for-college thing. But that kind of started off with the Vet Center program, and then on to the VA Medical Center, of how can we get them on board to think amongst themselves of how to simulate best practices that the university systems are already doing. like one university is doing something really well, and the other ones are kind of starting it off. And I was wondering whether or not you might see the need of trying to collect that up in partnership with like the Student Veteran Association that are most campuses to kind of target this 9/11 population group, and then also encourage them of sharing their data, like, because we're the experts, because we deal with veterans all the time, actually engaging with the schools and universities because they have so many different programs, just to see the aha moment. Maybe we can do a little bit better on like getting these student veterans to come at our schools, to retaining them, to making sure they're not failing, and then also addressing their needs for employment or access to care, to the free services in the community that we have. So that's what we've been doing with a partnership with the schools, enough where we're getting a lot more data through them now than us actually hunting down individually to do stuff.
So I facilitated the education solutions thing, and that came up as, I mean, not that in exact words, but what you're proposing definitely was brought up by the veterans themselves. So,
I don't know if you even know this stuff, but there has been a group of universities here meeting over the last couple months. But I've been encouraging as the foundation, so not in this role, but just we could be helpful to them, but they've got to be willing to be transparent. And it sounds like universities in North Carolina are willing to do that. I'm not quite sure yet that organizations in Pittsburgh are.
Okay, just checking. And then I know I haven't been here all morning and stuff like that. I've noticed a lot of CVEBs don't have vet center representation on their board, and I'm just curious about that. Just to reiterate, like, as far as brick and mortar on the federal VA side, you have your hospitals, outpatient clinics, and your cemetery is a regional office, but then there are vet centers that are located throughout that are a little bit different, and they have outreach teams that can probably do some of the legwork for you guys, because we're already out there.
yeah, we work with the vet center quite a bit. They're not on the board specifically, but they're some of the staff are some of the veterans that we've engaged, and they are people that we communicate pretty frequently with. A very good friend of ours is one of the outreach guy there for the Pittsburgh vet center.
Transparently, though, I will say, when you have, like, we didn't want half of the board to be VA. We wanted to have a lot of the community be on the board, and if we were to add the vet center person, that would, that's just another VA. Not that the VA is not very, very important. I'm not saying that, but just wanted to make sure that it was really, truly a
And it was a requirement to have the benefits to cemeteries and the VHA director on there.
And the Becky / now.
Which is, yeah.
So.
Hi.
It would have been 5 people.
Hey, can you guys hear me? Just to chime in, and you know, you're right. The big thing for Secretary McDonald at the time was VBA, VHA, and NCA. So the vet centers, you know, they don't have a reporting structure where they go up to the VA medical centers. But that was also a key piece, is that we have that point of contact, at least be an asset for the board. So not necessarily board members, we don't really care what they're called, but as long as they're an asset to the board and they're welcome to, you know, provide input and be part of the solution, that's the key. And then you're right, like the Becky Economic Communities Initiative, that's no longer in existence. But yeah, so for us, it's not as important as what people are called who are on the board. It's the participation and the active engagement and working together, no matter what you call them or who comes to the board meetings. It's what's the work that goes on behind the scenes. So yeah, we back up everything you say. So I just wanted to chime in on the vet centers, because that is important, you know, and oftentimes they are thought of as part of the VAMC, and they're not. But thanks, guys. You guys are awesome.